If you're over 60 and you've ever pressed a finger into your ankle at the end of the day and watched a dent stay there for several seconds, you've experienced something that happens to millions of people every single evening, and almost nobody understands why it's happening or what it's actually telling them about their body. Leg swelling, especially the kind that builds throughout the day and is worse at night, is one of the most common and most dismissed symptoms in people over 60. It gets blamed on just getting older, or standing too much, or too much salt, and sometimes those explanations are correct. But leg swelling can also be one of the earliest, most accessible warning signs your body gives you about the health of your heart, your veins, your kidneys, and even medications you're taking every day without a second thought. Today we're going to walk through exactly why legs swell more as we age, which patterns are ordinary and which deserve real attention, and what you can actually do about it. Because in most cases, this is a symptom you have far more control over than you'd expect. Why this happens more. After 60, to understand leg swelling, you have to understand what your legs are actually doing all day. Fighting gravity. Every time your heart beats, it pumps blood down into your legs. Getting that blood back up to your heart is a much harder job because it's moving against gravity through veins that don't have their own pumping power. Instead, your body relies on two things to push blood back upward: one-way valves inside your veins that prevent blood from falling backward, and the contraction of your calf muscles, which squeeze the veins every time you walk or move, acting almost like a second heart for your lower body. Here's what changes after 60. Those one-way valves inside your veins can weaken over decades of use, a condition called venous insufficiency. When they don't close completely, some blood slips backward and pools in the lower legs instead of returning efficiently to the heart. At the same time, many people become less physically active as they age, which means the calf muscle pump that's supposed to help push blood upward is working less often throughout the day. Add to this that blood vessel walls in general become slightly less elastic with age, and you have a combination of factors that make fluid more likely to accumulate in the lower legs and ankles by evening, even in someone who's otherwise perfectly healthy. This is why leg swelling that's mild, symmetric, worse at the end of the day, and better after a night's sleep is often just a mechanical consequence of aging veins and gravity. But not all leg swelling fits that pattern, and the differences matter enormously. The ordinary kind of swelling. Let's start with what's genuinely common and usually not dangerous. If you've been sitting for a long car ride or a long flight, sitting at a desk for hours, or standing for extended periods, think retail work, gardening, a full day on your feet. Mild swelling in both ankles and feet by evening is an entirely expected mechanical result of gravity and reduced muscle pump activity. This kind of swelling is almost always symmetric, meaning both legs look roughly the same, and it typically improves significantly or disappears completely after a night of sleep with your legs elevated on the mattress. Salt intake plays a role here too. Sodium causes your body to retain water, and retained water tends to accumulate in the same lower leg areas where gravity is already working against you. A particularly salty restaurant meal or a weekend of processed snacks can produce noticeably puffier ankles by the following evening, purely as a water retention response. Nothing more sinister than that. Heat is another everyday trigger. Blood vessels naturally dilate or widen in hot weather to help release heat from the body, and wider vessels are more prone to fluid leaking into surrounding tissue. This is why summer months often bring more noticeable ankle swelling for people who don't experience it as much during cooler seasons. If your swelling fits this pattern, both legs affected roughly equally, connected to a specific trigger like heat, salt, or prolonged sitting, and clearly better by morning, this is generally the low concern category. It's worth mentioning to your doctor at a regular visit, but it's not typically an emergency when swelling is telling you something more important. Now here's where this symptom becomes genuinely important to understand, because leg swelling can also be one of the earliest visible signs of several conditions that are much easier to manage when caught early. Heart function. When the heart's pumping efficiency declines, a condition broadly referred to as heart failure, which sounds far more alarming than it often is in its early manageable stages, blood can back up in the venous system, and fluid leaks out into surrounding tissue, most visibly in the legs and ankles, because gravity pulls it there first. What distinguishes this from ordinary swelling is that it tends to be more persistent, doesn't fully resolve overnight, and is frequently accompanied by other symptoms. Shortness of breath with activity or when lying flat, unusual fatigue, or a rapid, unexplained weight gain of several pounds over just a few days, which reflects fluid retention rather than fat gain. Kidney function. Your kidneys are responsible for regulating fluid and sodium balance throughout your entire body. When kidney function declines, which can happen gradually and silently over years, especially in people with long-standing high blood pressure or diabetes, the body loses some of its ability to eliminate excess fluid and sodium. And that fluid often shows up first as swelling around the ankles and sometimes around the eyes in the morning. Venous insufficiency and blood clots. We touched on weakening vein valves already as a normal aging process, but there's an important, more urgent version of vein-related swelling worth knowing, a blood clot in a deep leg vein, known as deep vein thrombosis, or DVT. This is genuinely one of the situations where swelling should prompt same-day medical attention, rather than a wait-and-see approach. The hallmark difference is that DVT swelling is typically one-sided, one leg noticeably more swollen than the other, often accompanied by warmth, redness, and pain or tenderness in the calf, sometimes described as feeling like a pulled muscle that doesn't improve. If you ever notice sudden one-sided leg swelling with pain, warmth, or redness, that combination warrants prompt medical evaluation rather than waiting to see if it resolves on its own, because an untreated clot can potentially travel to the lungs and become a medical emergency. Medications. This is the cause people are least likely to suspect, and it's remarkably common. Several widely prescribed medications list ankle swelling as a known side effect. Calcium channel blockers, a common class of blood pressure medication, are particularly well known for causing this. The swelling happens because these medications widen blood vessels, including small vessels in the legs, making it easier for fluid to leak into surrounding tissue. Certain anti-inflammatory medications, some diabetes medications, and certain steroids can produce a similar effect. If your leg swelling started or worsened around the same time you began a new prescription, that timing is a meaningful clue worth mentioning to whoever prescribed it, not necessarily to stop the medication on your own, but to discuss whether an adjustment makes sense. The simple self-check that helps you tell the difference. You don't need special equipment to get a reasonable first read on your own swelling. Here are the questions worth asking yourself, because the pattern matters more than the swelling itself. Is it both legs or just one? Symmetric, both-sided swelling points toward the more common causes we discussed: mechanical, salt-related, medication-related, or broader circulatory changes. One-sided swelling, especially if it came on suddenly, deserves more prompt attention. Does it improve overnight? Swelling that's clearly worse by evening and mostly or fully gone by morning fits the ordinary gravity and fluid pattern. Swelling that's present even first thing in the morning, or that's gradually gotten worse over days or weeks without improving, suggests something more persistent is driving it. Worth a conversation with your doctor. Is there pain, warmth, or redness? Painless swelling is far more common and far less urgent than swelling paired with pain, warmth, or skin redness, which can indicate either a clot or an infection called cellulitis, both of which warrant timely medical evaluation rather than home monitoring. Are there other symptoms alongside it? Shortness of breath, unusual fatigue, rapid weight gain over a few days, or reduced urination alongside leg swelling are signals that point toward heart or kidney involvement and are worth bringing to your doctor's attention specifically rather than mentioning leg swelling alone in isolation. None of this is meant to replace a real medical evaluation. It's meant to help you describe your symptoms more precisely and know when "let's keep an eye on it" is reasonable versus when "let's get this checked this week" is the better call. What actually helps? For the common, mechanical, end-of-day kind of swelling, there's a lot you can do, and much of it is simple. Elevate your legs above heart level for 15 to 20 minutes a few times a day, particularly in the evening. This uses gravity to help fluid drain back toward the torso instead of fighting against it all day, and it's one of the most immediately effective things you can do. Move regularly, especially your calves. Since your calf muscles act as a secondary pump for returning blood to the heart, even simple ankle pumps and calf raises done periodically throughout the day, flexing your foot up and down while seated or standing and rising onto your toes repeatedly, activate that pump and meaningfully reduce pooling, particularly if you sit for long stretches. Consider compression stockings. Graduated compression stockings, available over the counter in mild strengths or by prescription in stronger versions, apply gentle, calibrated pressure that's tightest at the ankle and gradually looser moving up the leg, which helps push fluid upward mechanically rather than letting it settle. These are genuinely one of the most evidence-supported tools for managing venous-related swelling, and they're worth discussing with your doctor if swelling is a regular occurrence. Watch your sodium intake, particularly from processed and restaurant foods, which tend to contain far more salt than home-cooked meals. This doesn't mean eliminating flavor from your food. It means being aware that a high-sodium day often shows up on your ankles by evening. Stay appropriately hydrated. This one seems counterintuitive, but dehydration can actually worsen fluid retention because your body responds to insufficient water intake by holding on to what it has more aggressively. Consistent, adequate water intake throughout the day supports better fluid balance than restricting water in an attempt to reduce swelling. Review your medications with your doctor or pharmacist, particularly if swelling began or worsened after starting something new. This is a conversation, not a decision to make alone, but it's a legitimate and often overlooked question to raise. Bringing it together. Leg swelling after 60 sits in an unusual category of symptoms, common enough to be dismissed as normal aging, but specific enough in its warning sign patterns that learning to read those patterns can genuinely help you catch something important earlier. Whether that's a medication that needs adjusting, kidney function that needs monitoring, or heart function that benefits enormously from early management. Most of the time, when both legs swell symmetrically by evening and look normal again by morning, this is simply gravity and aging veins doing what gravity and aging veins do, and the practical steps we covered, elevation, movement, compression, sodium awareness, make a real, noticeable difference. But your legs are also remarkably good at communicating early, before more serious symptoms show up elsewhere. Learning the difference between the ordinary pattern and the patterns that deserve prompt attention is one of the most useful pieces of body literacy you can carry into your 60s, 70s, and beyond. If you notice one-sided swelling, swelling with pain, warmth, or redness, or swelling accompanied by shortness of breath or rapid weight gain, don't wait to bring it up. Reach out to your doctor promptly. For the everyday kind, the good news is that you have more influence over it than you might have realized starting tonight with your feet up. As always, this video is for educational purposes and isn't a substitute for medical evaluation. If you have any new or changing swelling, especially alongside other symptoms, please talk to your doctor rather than relying on general information alone. They can examine you, review your specific medications and health history, and rule out anything that needs more immediate attention. Take care of those legs. They've been carrying you for a long time, and they're still trying to tell you what they need.